The presentation is about lung volume measurement. The contents are introduction, spirometer, lung volumes and their types, lung capacities, factors that reduced VC, explanatory factor that reduce VC. In the introduction, we see about lung volumes refers to the volume of air associated with different phases of the respiratory cycle, and the lung volumes are directly measured by the instrument which is spirometry. Next, we see about the spirometer. The apparatus is used to the spirometer is used to measure the volume of air exchanged during the breath and the respiratory rate. The record is called spirogram. In the spirogram, there are two deflection. The upward deflection is inhalation, downward deflection is exhalation. Adults averages volumes of is 12 breaths per minute. The tidal volume is amount of air inhaled and exhaled in and out of the lung volumes is 500 ml. Minute ventilation is refers to the total volume of air inhaled and exhaled each minute. The calculation of spirometer is 6 meter per minute for adult. The next, in a typical adult, the 70% of tidal value, that is 350 ml, reaches the respiratory portion of the system. Respiratory bronchioles, alveolar ducts, alveolar sacs, and alveoli. 30% remains in a non-respiratory passageways or conduct airways of the system. And atomic dead space, nose, pharynx, larynx, trachea, bronchioles, and the terminal bronchioles. Next, alveolar ventilation rate is the volume of air per minute that reaches the alveoli and other respiratory portions is multiplication of 350 ml per breath and 12 breaths per minute, that is 4200 ml per minute. There are four types of lung volumes: tidal volume, inspiratory reserve volume, expiratory reserve volume, residual volume. Tidal volume is nothing but normal volume of air inspired or expired during quiet breathing. TV, tidal volume, is equal to 500 ml. Inspiratory reserve volume, extra volume of air inhaled after tidal volume by max inspiratory effort, 350 ml in adult male or 3300 for male, 1900 for female. Expiratory reserve volume, extra value of air that can be exhaled after tidal volume max expiratory efforts. The value is 1100 in a normal adult male and 1200 for male and 700 for female. Residual volume, volume of air left out in lungs after forceful expiration and complete expiration, 1200 for male and 1100 for female. The right side picture shows the relation of volume, seconds and liters. The sine wave in the total lung capacity, and then the tidal value and expiratory reserve volume, expiratory capacity, functional residual capacity. In that we divide normal breathing and maximum inhale, recovery, maximum exhale. And the next picture shows the four types of tidal volume measurement. Lung capacities. Inspiratory capacity represents the maximum value of that can be inspired. Tidal volume of pulse, inspiratory reserve volume. The formula for inspiratory capacity is V1 plus I or V. Functional residual capacity FRC represents the volume of air left in the lungs after the normal expiration, and the expiratory reserve volume plus the residual volume ERV plus RV. Virtual capacity VC maximum volume one can exchange in a respiratory cycle sum of inspiratory reserve volume, tidal volume, and expiratory reserve volume. Inspiratory reserve volume plus tidal volume plus expiratory reserve volume. Total lung capacity is nothing but total air in the lungs at full inflection, the sum of inspiratory and expiratory reserve volumes plus to the tidal volume and residual volume. The left side picture shows the capacity in the lungs, and the right side shows the graph of the lung capacity. Factor that reduced VC: loss of distensible tissue, decreased compliance, increased residual volume. Extra pulmonary factors that reduced VC: limited thoracic expansion that causes examples are thoracic deformities and pleural fibrosis, limited diaphragmatic descent, nerve or muscle dysfunction. These two pictures is nothing but lung volumes and lung capacity. Thank you.